Imagine waking up one morning and feeling more tired than usual. Or maybe you've been brushing off that occasional chest discomfort or shortness of breath as something trivial. But what if these small signs are actually the warning shots of something far more serious? Heart disease, the leading cause of death globally, can often creep up on you without notice. In fact, 1 in 4 adults has some form of heart disease, and many don't even realize it until it's too late. But here's the shocking truth. Early signs of heart disease can often be silent, subtle, and easily dismissed. Today I'm going to reveal 7 silent indicators of heart disease that you should never ignore. Early detection could save your life, so let's dive into these warning signs that might be flying under your radar. It's easy to assume that heart disease always comes with dramatic symptoms, like severe chest pain or shortness of breath. However, in many cases, the signs are far more subtle, almost silent. Many people, particularly those without a family history or who are relatively healthy, ignore these early symptoms. But here's the thing, early recognition of heart disease can make all the difference. The earlier we detect potential heart problems, the sooner we can take action to prevent serious complications, including heart attacks or strokes. So, let's explore these silent indicators one by one and understand why it's critical to pay attention to them. Unexplained fatigue. Do you ever find yourself feeling drained even after a full night's sleep? That sense of exhaustion that lingers throughout the day, no matter how much rest you get. Does it sound familiar? While fatigue is often chalked up to stress or a busy lifestyle, unexplained fatigue can be a sign that your heart is not working as efficiently as it should. Fatigue, especially when it doesn't seem to improve with rest, can indicate that your heart isn't pumping blood effectively to your body, leading to a lack of oxygen and nutrients in the muscles and tissues. When your heart struggles to keep up, your energy levels drop significantly. And here's where it gets concerning. This type of fatigue may not feel extreme at first. It starts as a mild sense of being tired or just not feeling your usual self. But over time, it becomes harder to keep up with everyday tasks, like walking up a flight of stairs or carrying groceries. So why does this happen? The heart's primary job is to supply oxygenated blood to all parts of the body, including the muscles and organs. When there's a problem, like blocked arteries or heart valve issues, the body compensates by reducing energy levels, resulting in that nagging fatigue. But it's important to understand that this symptom is often gradual, making it easy to dismiss. People tend to blame work stress, poor diet, or even just aging for these feelings. But in reality, the heart could be signaling a problem. If you've been feeling unusually tired lately, even after adequate rest, it's time to listen to your body. Stay tuned to learn about another subtle yet important warning sign: shortness of breath. It could be connected and understanding. These signs together can offer a clearer picture of your heart health. Shortness of breath. Have you ever felt winded after climbing a few stairs or doing light physical activity? If so, you're not alone. But here's the thing, if you're experiencing shortness of breath that doesn't make sense, like getting out of breath after minimal effort, it could be a sign that your heart isn't functioning as it should. When your heart struggles to pump blood efficiently, the oxygen supply to your body, especially to the lungs, is compromised. As a result, your body's demand for oxygen rises, and the heart struggles to meet it. This can leave you feeling breathless, even when you're not exerting yourself. You might notice that this happens unexpectedly during simple tasks, like walking across the room or bending down to tie your shoes. The body's attempt to get more oxygen can leave you feeling like you just ran a marathon, even if you didn't move much at all. Shortness of breath could be linked to several heart conditions, including heart failure, coronary artery disease, or a weakened heart valve. The most common reason is that the heart isn't pumping enough oxygen-rich blood to the lungs, causing a backlog of fluid, which can interfere with your ability to breathe comfortably. In more severe cases, this can lead to fluid buildup in the lungs, making breathing even harder. So, if you're finding yourself gasping for air without a good reason, it's important to take notice. While it's easy to attribute it to being out of shape or having a cold, persistent breathlessness can be a warning sign of heart trouble. But don't worry. By recognizing this symptom early, you can take steps to prevent further complications. Next up, we'll look at swelling in the legs and feet, another subtle but important sign that your heart may need some attention. Swelling in the legs, ankles, or feet. Have you ever noticed that your feet, ankles, or legs seem to swell up, especially after a long day? Maybe your shoes feel tighter than usual, or you notice indentations where your socks were. While this might seem like a minor inconvenience, persistent swelling could be a red flag for heart problems. When your heart isn't pumping blood as efficiently as it should, it can lead to a backup of fluid in your body. This fluid tends to collect in the lower parts of your body, causing swelling in your feet, ankles, and legs. The reason? Gravity pulls the blood down into these areas, and if your heart isn't circulating blood effectively, it can't push that fluid back up. Over time, this leads to noticeable swelling. This type of swelling, called edema, often goes unnoticed at first because it starts small and gradually worsens. At first, you might just feel a little discomfort, but if the swelling becomes more persistent, or you start noticing it regularly, it's a sign your heart might need attention. In some cases, the swelling can be severe enough to make movement difficult, or even cause skin changes, such as tightness or shininess in the affected areas. If you find that your legs or ankles are swollen, especially in the evening or after sitting for a while, don't ignore it. It's a good idea to consult with a healthcare professional to rule out any underlying heart issues. While swelling could also be caused by other factors like injury or prolonged standing, it's crucial not to dismiss it, especially if other symptoms like shortness of breath or fatigue accompany it. Next, we'll discuss chest discomfort, a classic symptom that many associate with heart problems. Keep watching to learn more about how this subtle symptom could be a warning. Chest discomfort. We've all experienced a mild ache or tightness in our chest from time to time, often attributed to stress, indigestion, or even just bad posture. But when chest discomfort becomes more frequent or intense, it's a sign you shouldn't ignore. Heart-related chest pain often presents as a feeling of pressure, tightness, or a dull ache, and it can occur even when you're at rest. Unlike the dramatic heart attack scenes you see in movies, chest pain related to heart disease may not always be sharp or excruciating. In fact, it can feel like a heavy weight on your chest or a mild discomfort that comes and goes. You might notice this discomfort after physical exertion, emotional stress, or even when you're lying down, trying to relax. It's often subtle, but it's significant. This type of chest discomfort is usually caused by reduced blood flow to the heart. When the arteries supplying blood to the heart become narrow or blocked, your heart doesn't get the oxygen it needs, leading to a feeling of tightness or pressure. This can happen even during less stressful times, signaling that something might be wrong with your cardiovascular health. If the discomfort is accompanied by shortness of breath, dizziness, or pain radiating to your arm, jaw, or back, it's a clear signal that you should seek medical attention immediately. Even if it's mild, it's better to be safe than sorry. Don't write it off as something minor. It could be an early sign of coronary artery disease or even a heart attack. Next, we'll talk about dizziness and lightheadedness, another often overlooked symptom that can be linked to heart problems. Stick around to learn why these feelings may not be as innocent as they seem. Dizziness or lightheadedness. Have you ever stood up quickly and felt like the room was spinning or you were about to faint? It's easy to brush off occasional dizziness or lightheadedness as nothing more than a sudden drop in blood pressure. However, when these feelings occur regularly or without a clear cause, they could be a sign that your heart isn't pumping blood effectively, and that could signal a bigger problem. When your heart struggles to circulate blood efficiently, it can cause a drop in blood pressure, particularly when you change positions, like standing up from a sitting or lying position. This sudden decrease in blood flow to the brain can leave you feeling dizzy, lightheaded, or even on the verge of passing out. If this happens frequently, it's worth paying attention to. While dizziness can be caused by many things, including dehydration or medication side effects, chronic lightheadedness or fainting episodes could point to an underlying heart issue. It might be linked to heart valve problems, arrhythmias, irregular heartbeats, or even heart failure. When the heart can't pump enough oxygen-rich blood to the brain, you may experience these uncomfortable sensations. If you notice dizziness or lightheadedness happening more often, especially if it's paired with other symptoms like shortness of breath or chest discomfort, it's time to consult with a healthcare professional. Even if it's just a mild sensation, don't ignore it. Your body could be trying to tell you that something isn't right with your heart. Up next, we'll take a look at cold sweats, another subtle sign that your heart may be in distress. Stay tuned to understand how this unexpected symptom could point to something more serious. Cold sweats. Have you ever found yourself breaking out in a cold sweat, seemingly for no reason at all? Maybe it happened while you were resting, or even during a calm moment when you weren't exerting yourself. While it might seem like a passing discomfort, cold sweats can be a subtle but serious sign that something is wrong with your heart. Cold sweats occur when your body experiences extreme stress or when it's not receiving enough oxygen, and your cardiovascular system is in distress. This often happens when the heart is struggling to pump blood effectively, and the body starts to go into emergency mode. The body's response is to release sweat, even though it's not due to physical exertion or heat. You may notice your skin becoming clammy, your hands getting cold, or a feeling of sudden chills, even if you're not in a cold environment. This kind of sweating is different from the regular perspiration you get during exercise. It's often accompanied by feelings of anxiety, dizziness, or nausea. In many cases, cold sweats can be a sign that your heart is under stress, and if left untreated, it could lead to more serious issues, like a heart attack. The body's automatic response to this stress is to sweat in an attempt to regulate body temperature, but it's also a signal that your body is in crisis. If you've experienced cold sweats without any obvious cause, especially alongside symptoms like chest discomfort or shortness of breath, it's crucial to seek medical attention right away. While cold sweats alone may not necessarily mean you're having a heart attack, they should never be ignored. Up next, we'll discuss why recognizing these signs early is critical to protecting your heart and your health. Stay tuned for more information on how to take action when your heart is sending you signals. 7. Jaw, neck, or back. Pain. It might surprise you to learn that pain in areas like your jaw, neck, or back can be linked to heart problems. While many people associate heart issues with chest pain, the discomfort can radiate to other parts of your body, and sometimes it's these less obvious areas that signal trouble. When your heart isn't receiving enough oxygen-rich blood due to blocked arteries or a damaged valve, the body can send out warning signs in unexpected places. Pain in the jaw, neck, or upper back, particularly on the left side, is often one of these subtle signals. It might start as a mild ache or stiffness, and you might think it's just a pulled muscle or something that'll go away on its own. But if this pain comes on suddenly, especially in combination with other symptoms like shortness of breath, dizziness, or chest discomfort, it could indicate that the heart is in distress. This type of pain is often referred to as referred pain, meaning that the source of the discomfort isn't necessarily where you feel it. The nerves in the chest and upper body are connected, and when the heart is in trouble, the brain might interpret the pain in other parts of the body like the jaw, neck, or back. If you've been experiencing any unexplained pain in these areas, especially if it's persistent or comes with other signs of heart issues, it's essential to take it seriously. Even mild pain in these areas, when combined with symptoms like nausea or sweating, could point to a heart attack or other serious heart conditions. Next, we'll dive into how to take action when you notice these symptoms. Recognizing the signs early can be the key to preventing a major heart event. Stay tuned to learn the steps to protect your heart and overall health. Did you know that heart disease can sometimes remain dormant, only to appear when the damage is already done? This is why paying attention to these subtle, often overlooked signs is crucial. Just because you're not feeling an intense pain doesn't mean everything is fine. Your heart speaks to you through these silent indicators, and it's up to us to listen. Think about it. Many of us have been conditioned to ignore discomfort or chalk it up to stress or overwork. But the truth is, our bodies are intricate systems, and when something is wrong, they give us signals. no matter how quiet or indirect. Isn't it interesting how the body often tries to warn us, but it's up to us to take those warnings seriously? In conclusion, heart disease doesn't always come knocking with dramatic symptoms. Instead, it often sneaks up on you with quiet, subtle signs that can be easily brushed off. Understanding these 7 silent indicators of heart disease could save you from a devastating heart attack or stroke in the future. Early detection is the key to better outcomes, and your heart deserves the care and attention that you give to other aspects of your health. So take a moment today to reflect on your own health. Are you noticing any of these signs? If so, don't hesitate to get them checked out. Your heart is worth it. If you found this video helpful, don't forget to like, share, and subscribe for more insightful health advice. Your support helps me bring more content like this, aiming to improve lives one story at a time. Also, drop a comment below. Let me know which silent symptom surprised you the most, and share this video with someone you care about. Together, we can make health awareness go viral.